Sinusitis is a very loose definition, basically meaning any inflammation of the sinuses. That doesn't necessarily mean bacterial infection. It can be viral, it can be allergic, it can be all sorts of things. But the loose definition of sinusitis is inflammation of the sinuses. And this is probably one of the most common reasons that people seek attention with a primary care practitioner. So this is extremely common, making for a huge healthcare burden in terms of costs, and certainly in terms of the investment of time that a physician will have in the office. So there was a new position paper put out this year describing recommendations for management of sinusitis. And here again, for the most part, the recommendations are watchful waiting and supportive care, and for more complicated situations, then antibiotic therapy, and then for even more complicated situations, surgery. Primarily, in terms of differentiating them, there is a cardinal symptom. The cardinal symptom is primarily purulent nasal discharge. So, when you have clear nasal discharge, itchy eyes, watery eyes, and sneezing, it's allergy. When you see pus coming out of the sinuses, that really suggests that there is an infectious component. And really that also suggests it's a bacterial component. Pain and pressure and fullness, those things tend not to be particularly specific, and it can be hard to differentiate allergic from infectious sinusitis, but when you see purulence, then you have your hallmark. The watch and wait is for the routine sinus patient who comes in. Usually it's uncomplicated, that is, they don't have any evidence that the sinus infection is extending beyond the sinuses. It is appropriate usually to watch somebody and wait for about 10 days. And once you start to see that things are either getting worse in the course of those 10 days or really not improving, that's when it's appropriate to intervene, particularly with antibiotics. From the standpoint of when it's appropriate to consider surgery, we generally consider surgery for a couple of situations. One, the recurrent acute sinus patient who comes back time after time, and that's usually 4 infections a year is the cutoff. The chronic sinusitis patient is more of a vague complaint. These are patients with chronic stuffiness and congestion. In the most advanced form, that's nasal polyps, which is something that pretty much almost always requires surgery. But there certainly is a spectrum in which surgery is appropriate, and obviously it also has to be tailored to the individual and what their goals and expectations are. Well, the medications that you can consider include decongestants, which open up the sinuses occasionally, the use of steroids, particularly topical steroids, which again do the same thing. They reduce inflammation and open up the sinuses. You have antibiotics, which obviously are for the bacterial component of sinusitis, which can occur sometimes. But it's not even necessary at all times with the bacterial sinusitis to treat with antibiotics. There are appropriate times when it's just reasonable to watch and wait. And then there are medications such as mucolytics, guaifenesin, it's all over the TV these days as Mucinex, which perhaps has some support. And last but not least, something that's really routine and appropriate to offer, which is saline irrigation. So it's really the irrigation of the sinus is more than just the spritzing of saline. Surgery actually is what's called endoscopic sinus surgery, and endoscopic sinus surgery is not minimally invasive surgery in which we basically just try to restore the natural drainage pathways of the sinuses for people in whom it's really obstructed and blocked. And there are a number of ways that can be done, probably not relevant to the discussion today, but it's really come a long way. Sinus surgery has advanced tremendously, really from the 1990s on, and it's outpatient. It generally tends to be a fairly benign recovery for the vast majority of people. It's not generally very painful, and really has major impact on quality of life. There's a lot to support the use of sinus surgery, obviously, for the appropriate situation and the appropriate individual. 90% of the time, you are done. There are some patients who require a revision, particularly the nasal polyp patients, and those patients, unfortunately, despite our best efforts, often will have recurrence of polyps and require revision surgery. But with appropriate medical treatment, we can often keep them out of the operating room for at least lengthy periods of time.